to welcome you to our public awareness program, Expert Talk on Management of MASLD and MASH. Our aim is to provide top-notch education and awareness about fatty liver disease to healthcare professionals, patients, and their families. Today, we are honored to have Dr. M. Ganesh, a renowned gastroenterologist from Coimbatore, as our speaker. With over 20 years of experience in the field, Sir is known to provide exceptional care to his patients for treating various gastrointestinal disorders. His commitment to patient centered care and spreading awareness about MASLD is truly commendable. So, today we are grateful for his dedication to improving liver health and educating others about this important topic. So, without further ado, I would like to invite Dr. Ganesh to share his valuable insights on management of MASLD. So, over to you, sir.
Hey, good evening, everybody, friends and delegates who are participating in this meeting with me. So we are going to discuss a very, very interesting topic. I am Dr. Ganesh, gastroenterologist, hepatologist, and interventional endoscopist from Coimbatore. My center is in SG Gastrocare, which we do all the advanced liver-related work, and we care a lot of patients with the new pandemic which is going all over the world, which is this not the corona, but more than that, we have this fatty liver. So each and one in three patients are having this sort of problem when they're doing an ultrasound. So we're going to discuss about it. So I thank Zydus for providing this digital platform to interact with directly with the audience, as well as with the people who are participating in this program. As a commonly I would say, it's a general public. So it gives me an opportunity to give you an idea and also an important message about a new problem which is spreading all over the world, and it is life-threatening. It's a slow poison killer, which you will not realize immediately when you have this problem. It takes a few years for it to develop the complications and liver-related cirrhosis, liver damage, and liver transplantation. This is the way it proceeds nowadays. So I'm going to talk to you about this most important topic. And I've given various lectures to colleges, schools, as well as to various corporate societies, because these are the places where this problem is increasing day by day. So I had a practice in London as well. I lived in London for 12 years, and I worked in Manchester Royal Infirmary, Salford University, South Manchester University Hospital within Shire, and various renowned universities were caring for the liver as well as for inflammatory bowel disease in United Kingdom. And I was a consultant for Sheffield University Medical College and reputed teaching hospital for a few years before coming to India. So after coming back to India, I was in a corporate hospital in KMCH heading the Department of Gastroenterology for 6 years. And then after that, I started my own practice, which is SG Gastrocare in Coimbatore, which is opposite to Ramakrishna Women's Arts College, and it's called a place called Avarampalayam, New Siddharpur. So this is in a nutshell about me, because I was trained in UK and worked in UK, and I know the disease pattern and spectrum in both the worlds, like in Asian countries as well as in the European countries. So most of the disease, like the non-infectious disease we call, that means it's not spreading through the virus, bacteria, or any living organism, is more common in Europe. The infectious disease are more common in European, not European, in our Asian countries, because we have a lot of bacteria, virus in the environment. So one of the most non-infectious problem which the Europeans were facing was fatty liver, and also heart attack, diabetes, stroke, and cancer. And along with that, the inflammatory bowel disease, COPD, and liver failure due to smoking as well as due to alcohol. This is the main bunch of patients I normally see in the Europeans. I thought that the Europeans have damaged their lifestyle by doing all unnecessary food, eating red meat more, pork, and also fast foods more common, and then drinking a lot of alcohol and smoking, and a sedentary lifestyle with obesity contributing to the factors. So I thought India would be different. When I came back to India, I was shocked to see similar pattern which is evolving in India as well, because most of us have changed our lifestyle pattern. because of the Western type of work we take. More stress, overnight working, unhealthy dietary habits, and also involving in more alcoholism as well as smoking and less exercise, physical activity. And we concentrate more on our mental activity, and you sit in the chair and do the work all the day, and then you go home, have some pizzas, burgers to relax your stress, and then go immediately to bed after watching a couple of movies. And this is the most dangerous recipe. Now, even if you have a bacterial infection, which can be treated, or a virus infection treated by a few days of antibiotics or antiviral for 2 or 3 days, and you get better and you're off. But if you do this practice of unhealthy lifestyle, sedentary lifestyle, eating too much, and working less in terms of physical activity, then you are prone to this problem of fatty liver. That means whatever you take in excess, which is not used by the body for energy, is stored in the liver, because the liver is the storage organ. It's like a retail and a wholesale shop. The retailer does not have that wholesale type of goods which the warehouse has. So he has to spend small amounts of retailing goods every day. That's how we eat, and then we spend the energy. But if you take too much of food, like the retailer is getting 20 to 30 bags of rice or wheat, which he cannot sell, so he has to put it in the warehouse. So if it keeps on swelling, the warehouse can get damaged, because we are not using it much, but keep on storing, and one day the warehouse space is going to be not sufficient to store the extra material you have, which is actually good. Fat is good for us, because your storage fat is the one which is released when you are in starving, so that the fat is converted into energy. But if anything too much is not good. In Tamil, we say that alavakka minjinal amrutamam nanchi. That means even amrita keeps one immortal. But if you take too much of amrita, that itself can be dangerous for your body to die also. So that's how everything in moderation and correct amount is good for the body and health. But this new pandemic means the problem which is spreading all over the world. Epidemic means which is spreading inside a country. An endemic is, that means the problem is present in that particular area. But this fatty liver problem, which you might have encountered in your family, friends, as well as in your community, people saying that I went for a scan for a pain abdomen, and the doctor told me that I have fat in the liver. So I don't think that it's much worrying factor. It was, but now the fat, what it does is we are understanding the mechanism of excess fat depositing in the liver, slowly damaging the liver, and the liver gets inflamed, injured, scarred, and become cirrhotic. So you have seen people with hot belly, like fluid accumulating in the abdomen, in the legs. They're getting lots of fluid, jaundice, and liver failure. They don't know the cause for it, but predominantly it was like alcohol-related liver damage and virus hepatitis B and C. These were the most common cause for the persistent liver damage, liver cirrhosis, and transplantation until 15 years ago. Last 10 years, the fatty liver has taken over everything in the liver disease. And in Europe and in India, the commonest cause for liver transplantation is due to excess fat, which has caused the continuous damage, cirrhosis, and liver failure. So it's not a one-day disease that you know that you eat one day and your fat gets accumulated in the liver and you're going to die. No. So it is everyday process. A slow poison, as I said, like an arsenic poison in the Greek literature is also in our Indian tradition, where they give drugs which can, or chemicals added to the food to the kings or king's family, slow poisoning. So they accumulate and kill you over a period of time, which nobody understands. At the end of the death, they will understand that he's died. I don't know why he died. So similarly, we have now a situation where the liver is getting damaged. Nobody knows why for a long period of time, but now we know why. And many people died of liver cirrhosis without understanding why it has been damaged. So now we are going into looking into this most important topic of fatty liver, where the liver is getting more than 30% of fat in each cell. So if more than 30% fats are accumulated in the liver, then it starts damaging. So now previously it is called non-alcoholic fatty liver. So when people who don't drink alcohol were also getting this liver disease. So that's what the people were wondering, why people are having disease even if they're not drinking alcohol. So they suddenly called it as non-alcoholic fatty liver. But non-alcoholic fatty liver disease means there are a hell number of diseases which can produce fat in the liver. Not necessarily you should be drinking alcohol. So without alcohol also, we can have disease which can put fat in the liver, like drug-induced toxicity or viral diseases, toxin-mediated, and also some autoimmune disease also can put fat in the liver, so that they don't come under now a category of non-alcoholic fatty liver disease. So they are separate entities which can produce fat in the liver. But the most worrying part is because those diseases are very few in number in the world. The most worrying part is this metabolic associated liver disease, that your metabolism is not working properly to break the fat stored in the liver, or you are accumulating more fat because of certain metabolic derangements, or if you are overeating and under exercising or not utilizing the fat properly which is stored in the liver, can cause a fatty liver. So this part of the problem is called as metabolic associated steatotic liver disease. Okay. So only when you have a metabolic problem, like what I told, what are the metabolic problems? I will tell you one by one. So when you have a metabolic problem, that means you are not breaking the fat properly and you're accumulating the fat in the liver, leading to liver damage, cirrhosis, liver disease is called metabolic associated steatotic liver disease. Steatotic means fat, accumulation of fat in the liver, or MASH, metabolic associated steatotic hepatitis. That means once your fat accumulated, the next stage, as I told you, is a damage and injury, which is called MASH. From the MASH, it goes to cirrhosis. So we previously it's called cryptogenic cirrhosis or idiopathic cirrhosis. People called it different names because they didn't know why it is happening. So idiopathic means doctor doesn't know, patient doesn't know why the liver is getting damaged. So that was the scenario before, but now we know the cause for this. So can we go for the next slide? So as you know, the second largest organ in the human body is the liver. So it has more than 500 plus activities like storage of fat, storage of carbohydrate, proteins, and also various other production of hormones, immunoglobulins, immunity, clearing the toxins. You name whatever you in the body, the liver does. And the largest organ before the liver is the skin. We call skin is the largest. Skin is also an organ. So it's the largest surface area and largest organ. And now the liver has an enormous capacity to regenerate as well as to do various other work. And it is situated in the right side of the abdomen, which is pink in color. The next one is next slide. So as I told you, the liver has various functions. So injury to the liver can affect the various functions and it can produce the jaundice, which is one of the main important functions of the liver is to production of bile, which contains bilirubin, a chemical which is yellow in color, which is necessary for the breakdown of the food and digestion of the food. So if it spills into the blood, you get jaundice. And if the liver enzymes, the enzymes are present in the liver because most of the conversion of chemicals happens in the liver like a storage process. It breaks down the materials into smaller pieces and goes to the liver and it converts into another shape for storage. So the chemicals in the liver like SGOT, SGPT, ALT, AST we call, they're all in the liver. So when they are in the liver, when you get liver damage, these chemicals are released. So that's how you detect if you have a damage to the liver. When you do a blood test, your bilirubin, SGPT, SGOT, if they're abnormal, it indicates that some amount of damage has happened to the liver. We need to identify what is the cause. It could be fatty liver, it could be drug, it could be virus, it could be iron, chemicals, toxins, and immune disorders, various things. So the liver has hundreds of work to be done and it has hundreds of enzymes in it. So if there is a damage, the enzymes are released in the blood and they can be identified by the blood test. Next one. So here you can see that the liver is studded with a lot of fat vacuoles. You can see the fat gives as a white appearance in the liver. So this is the histology we call. Take a sample of the liver tissue and analyze on the microscope. All the cells should be like this pink color, very nice, beautiful looking, but they are infiltrated with a lot of fat. So these fat can displace the nucleus and damage the cells. This is how a fatty liver looks. So this fatty liver disease is called nowadays as metabolic dysfunction associated fatty liver disease. So MASLD, the S is called state protein. So when you're overweight, eating more than what you spend, or if you have diabetes, high cholesterol, high blood pressure, high triglycerides, then it is called as, we have one of those factors with fat in the liver, then we call it as metabolic associated fatty liver disease. If you don't have this and still you have a fatty liver, then it doesn't come under metabolic associated fatty liver disease. It is simply called as fatty liver disease due to other cause. Next slide, please. So as I said, the prevalence we have said is 1 in 4, but it's only tip of the iceberg. We know that 1 in 3 all over the world is affected by the fatty liver, and this problem is seen more common in diabetic population. This fatty liver due to diabetes is very high because when you have diabetes, you don't have enough insulin. The insulin production is reduced in diabetic population, and you know that insulin is necessary hormone that helps to break the fat in the liver. So if you don't have enough insulin, the fat doesn't get broken. Or if you have an insulin resistant pattern, that means the insulin cannot act even if it is produced, then the liver fat gets accumulated rather than getting broken down. So majority of the diabetics, I would say 70% of the diabetics have fatty liver. So you should be very careful when you have a diabetes, high blood pressure, high cholesterol, triglycerides, or high uric acid level in the blood, then you are likely to have one of these metabolic associated liver disease with fatty liver. So you should be very careful to check these frequently. And if you have a family history, people suffering from fatty liver in the family, diabetes, hypertension, and they have a high incidence of their children developing the same problem. So when you develop fatty liver, it means that in a few years' time, 5 to 6 years, even if you're not a diabetic, you are going to develop diabetes. It's like a warning. As I said, the insulin production is reducing in your body, or it's not acting properly, so your fat is not getting broken down. So one point of time when you get very low production of insulin, the blood sugar starts increasing and it produces diabetes mellitus and high blood sugar related complications in various organs and the nerves. So that's how a diabetic patient also starts developing complications. Next. So this I've already told you even before showing this slide, that excess fat accumulation from the healthy liver, and you see the color of the liver has changed to yellow in the second cartoon, where this fat has accumulated and the fat causes damage and scarring, and later leading to excess scar tissue getting rounded off and studded like nodules all over the liver, and the liver loses its function. So when you get more than 70% of the liver replaced by scarring, I think the only option for you to survive is by doing a liver transplantation. So our job or our information or awareness should be that we should stop progressing from this stage to this and start reversing it back to the normal. It's very easy from this stage, slightly difficult from this stage, but not possible from this stage to come back to a normal, healthy liver. Next, please. So the fat accumulation not only causes injury, scarring, damage, and finally it leads to cirrhosis. The scarring is called fibrosis. Fibrosis means there is a cell called fibroblast in the body which produces extra collagen or fibers to seal the area of injury. So when there is an injury, lots of fibers are produced to seal that inflammation and injury, and fibrosis, meaning where the scar tissue has started developing. Next, please. So we know that the fatty liver can be due to various problems, as I said previously, but predominantly when you're talking about MASLD or metabolic associated liver disease, it is due to a metabolic abnormality which you should think, and all others like exposure to medicine, genetic, are not related to metabolic associated liver, especially in physical inactivity, food intake, obesity, diabetes, high blood pressure, high cholesterol, and plus fat in the liver is called MASLD. And if it is getting worse with more scarring and fibrosis, it's called MASH. And when it leads to cirrhosis, we call cryptogenic cirrhosis or fatty liver associated or MASLD associated cirrhotic liver disease. Next, please. So overeating with too much of trans fatty acids, we say. The trans fatty acids are nothing but fatty acids which the human body cannot break down. So taking fats which are heated to more than 30 degrees, too much of cheese from the pizza and burgers, it's very difficult for the body to break it down, and they get deposited in the liver every day, and you lead to deposition in other parts like obesity and also which contributes to the injury further, like MASH development and cirrhosis. Next, please. So high prevalence of diabetes and fatty liver, they are linked to each other, as I already explained to you. Like there's a threefold increased death due to cirrhosis, and also increased risk of MASH in diabetic population. So diabetic population should be very much aware and screening for fatty liver by doing ultrasound and some blood test and elastographic methods. And we have some FIB4 calculation. That means if you put in the net like FIB4 calculator, it will ask for your age, that enzyme I told you, the ALT, AST, as well as the platelet count. So if you add these values in that, that will give you a score. If it is less than 1.3, still you're safe. And if it's 1.3 to 2.6, you are at an intermediate risk with fatty liver disease. And if it's more than 2.6, then definitely already have started having fibrosis or cirrhosis. So you can check on the internet and easily evaluate by doing small blood tests like platelet count, AST, and ALT. Next paragraph. So mostly, as I said, when the fat started accumulating in the liver, it's very silent. They don't have any symptoms to present initially. Later part of the time, when the fat accumulates more and it starts making the liver bigger, then it stretches the capsule and can produce severe right upper quadrant pain, body pain, nausea, joint pain, tiredness, lethargy, weakness, and you don't feel like eating. So those sort of symptoms can occur in few patients before the liver is completely damaged. When the liver is completely damaged and cirrhosis has started setting in, then you can see the pot belly where fluid is accumulated in the abdomen, and edema, that means fluid in the legs, jaundice, redness in the palm, and also confusion, hepatic encephalopathy, and they can go to coma as well. So it's up to you to decide. So the early symptoms or early warnings, then you should always consult your hepatologist or gastroenterologist nearby so that you can check your liver enzymes, ultrasound, elastography, to see that are you progressing in the liver disease due to metabolic associated fatty liver. So watch for right upper quadrant pain, tiredness, weakness, fatigue, joint pain, and lethargy. If you have these things, check your blood sugar, blood lipid levels, as well as blood pressure and ultrasound abdomen and liver enzymes. This will give a clue whether you're developing a fatty liver. Next, please. So I already told you everything. So how to diagnose MASLD, fatty liver, or non-alcoholic steatohepatitis injury. Simple blood test, ultrasound, elastrofibrography. Elastograph is nothing but you put a pen-like structure on the surface of the rib in the right side of the chest, lower chest, where the liver is located. And the ultrasound waves sent through it will receive back, which, depending on the stiffness of the liver, the reflected ultrasound waves are analyzed in the computer chip system. Will tell you how much stiff the liver you have, how much fat you have accumulated. Just 2 minutes, and you can get every details of your liver. Very advanced, and we do this elastography in our center and picked up a lot of patients who didn't have any symptoms but just came for routine checkups and for other treatments, and we picked up these fatty liver disease and given them adequate advice and medications to reduce the fatty liver, to prevent them from going into fibrosis and cirrhosis. Next paragraph. So when you're checking your bloods, as I told you, the enzymes, if they're persistently increasing, it means there's a progressive damage. You should be very careful. You have to see your gastroenterologist, and aggressive lifestyle changes, physical activity, dietary modification, and also think of starting on adequate medications like that. There's so many medicines nowadays available, which I can say like ursodeoxycholic acid, ursodeoxycholic acid, vitamin E, saroglitazar, resveratrol are available now, which can reverse the scarring, reverse the fat, reverse the metabolic abnormalities. Next, please. So I told you already, I think that we'll be looking at the score models. If you type your age, AST levels, ALT levels, which is nothing but SGOT, SGPT, and platelet count on the internet system, it will give you a score. And the other online scores being like a NAFL fibrosis score, which also includes the BMI, sugar, and albumin levels. So the easiest one is the FIB4 score, which you can easily access with a less number of parameters, and you can identify whether you are at risk of developing more complications related to fatty liver. Next, please. So ultrasound is the easiest technique to detect this fatty liver. Not necessarily you go for particularly to detect for fatty liver, but if you have abdominal pain or various other problems which your doctor asks for an ultrasound and you do a scan and incidentally they find that the liver is replaced with a lot of fat. Now you can see the first side which stays normal. The liver is bit of a black in color. And then you can see the next one, when the fat starts accumulating, it becomes white. And when it's become shrunken, you can see the cirrhotic, the liver is small, studded with nodules and irregular surface. The smooth surface of the liver is replaced by irregular surface on the last picture. So diabetic people have, if they have fatty liver, the risk of progression to cirrhosis and complications are very high. The more the number of metabolic problems you have, as I mentioned, blood pressure, high blood sugars, high cholesterol, high triglycerides, high uric acid level. And if you have all these parameters increasing one by one in your body and you have fatty liver, your chance of having more damage to the liver is high due to excess metabolic abnormality, which is predicted by increasing number of abnormalities you can count in your body. So the one metabolic factor and fatty liver, the chances that progressing to severe problems is the risk is less. But if you have one or more metabolic complications or problems, as I mentioned, and you have fatty liver along with that, then your chance of progressing to cirrhosis or liver failure is high. So you are the high risk categories when you have more number of tick factors along with liver fat getting more in the scan or if you do by a test. So in these cases, then you should be seeing your gastroenterologist and get a good advice regarding diet, health, exercise, as well as medications. Next, please. So next slide. So the easiest way of checking your liver is this the new machine available in the market for the past few years, where you put this probe. You can see the probe on the gadget, and you put the probe on the surface of the skin on the chest, and you get the liver stiffness, the LSM measurement, and the controlled attenuation parameter called CPAP, which measures the amount of fat accumulated in the liver. For your information, the LSM should be less than 7.2 value to say that it's a healthy liver without scarring. And the CAP value, which measures the fat in the liver, it should be less than 230 value, so that it means that your fat in the liver is not excess. So if you find any value more than this, then it indicates that your liver is getting more fat and more damage. Next. So other tests are CT scan, MRI. They're very costly. They're not widely used, but still we can use MRI. But I use ultrasound and elastography in my clinic, and also the blood test, which will be enough. And if in doubt, or if there's other associated liver disease contributing to fat in the liver, to detect them, then we can do other blood test or liver biopsy. Next, please. So liver biopsy is done only when the liver enzymes are very high and you're very obese, and your ultrasound showing some changes, and the fibrotic score, FIB4 score is high, or elastography score is high. So to quantify or to measure the real standard, gold standard test is to do a biopsy to assess how much liver has shrunken, and how much inflammation is there, and how much fat has accumulated. So 3 points can be seen by doing a liver biopsy, which we don't routinely do, because we know with the advent of elastography as well as ultrasound and also the FIB4 score system, we should be reasonably able to diagnose your stage of fibrosis and the fat accumulation in the liver. If you still have doubts, as I said, to exclude other liver disease, and also to assess the exact amount of damage and the severity of the illness, and to grade and to characterize your problems leading to cirrhosis, how much quick you are going to get into cirrhosis, or how much you already developed cirrhosis, or how much aggressive treatment you need to have, then we do liver biopsy. Next slide, please. So not all the, this is a busy slide, but I'll just tell you the breakup of this slide, and you can listen to me, that whenever fat accumulates, they start progressing to fatty liver, and the fatty liver with 70 to 75% goes to fatty liver, and out of that 20% starts damaging the liver and producing NASH, that means MASH, hepatitis or inflammation due to the fat. And then out of that 10% goes into cirrhosis, and out of that another 10% goes to liver failure and cancer. So whenever you have fat accumulated in the liver, your risk of developing diabetes, cardiovascular complications like heart attack and cancers also progressively increases. And if your fibrosis level increases, that means the scarring is more by fibroscan, and more metabolic abnormalities you detect in the blood, like high blood pressure, high sugar, high cholesterol, high triglyceride, overweight, hyperuric acid levels, and associated with fatty liver, the chances of cardiovascular malignancy, cancers, and also diabetes getting worse is high in your condition. Next slide, please. So you should be acting as early as possible before the fatty liver kills you. It gives you enough time, actually, because it takes 15 to 20 years from fatty liver to liver cirrhosis and liver cancer and liver cancer. So a hell lot of time before you can correct yourself for your dietary abnormalities, your physical inactivities, and also the metabolic abnormalities, blood pressure, sugars, cholesterol. You can take drugs, do exercise, do yoga, in which there are a lot of practices in yoga which can reduce fat in the liver. So in that Vakrasana, Salabhasana, Surya Namaskara, and also you get Vajrasana. All these exercises are very good for liver and reducing the fat in the liver. And don't take any trans fatty acid containing foods, that means repeatedly cooked or highly heated oils, and also avoid beverages like Coke, Pepsi, or all these containers, sweetness, additional preservatives, and mayonnaise. We recently had paper news coming out in the dailies. Mayonnaise is now called as a dangerous substance to the liver and liver toxin and liver damage. So avoid mayonnaise, avoid these trans fatty acids. Don't take this finger chips or potato waffles, like things which are cooked in a very high heat and oil. Don't use palm oil, and these things can prevent you from having abnormal fat accumulated in the liver. So very important. So more of vegetables and also legumes or fruits. They are very good in terms of reducing the fat in the liver. And also you can try with fenugreek seeds. They are very good. And pumpkins, white pumpkins, and also the water, the rice water we call. When you soak the rice in the night and then you take that water out in the morning and drink that water, it's called rice kanchi water, which is very good probiotic, and it reduces the inflammation in the intestines and prevent toxin materials entering into the liver, producing fatty liver. So these are the few tips I can give you. More of vegetarian food, no non-veg or very less non-veg. Don't eat red meat. Don't eat processed food. Don't use deep freezed or deep fried items. And also do a lot of physical activity, 30 to 40 minutes of fast walking, jogging, or do at least three times a week yoga practice for 1 to 1.5 hours will reduce the fat in the liver, and also physical activity increases the healthiness of the liver and metabolic parameters. Next slide. I told you everything: lifestyle modification, no alcohol, no smoking. And if still you don't control your fatty liver with all the things which I told you, then we have a lot of new medications which can help you to reverse the fatty liver as well as the MASH. Next, please. So reduce your weight. The 10% weight loss can reduce 30% of your fat in the very important. So try to reduce your weight gradually. So even if you drop your weight 500 grams per month is enough. In a year, I would expect you to drop to 5 to 6 kilos. And in 5 years, you drop 20 kilos. It's more than sufficient. Don't drop it too rapidly to enter into complications. And regular routine exercises will help you. Next. So I said the resolution of the various grades of changes in the liver, like steatosis, that means fat accumulation, inflammation, and a resolution of the inflammation, resolution of fibrosis. The, the more the percentage of fat loss, or sorry, weight loss, like 3%, 5, 7, 10, you can reverse your liver damage very fast and in a higher note. Next slide. So healthy food, I already told you what are the things to be taken, what not to be taken. Next, please. This is also, I told you, aerobic exercises, and some part of things that you need to do is a resistance exercise. Do weightlifting, small weight, 5 kilos, 10 kilos weightlifting, two times a week, and also 3 times a week yoga, 3 times of fast walking. All should combine with each other, will help you to have a normal liver and reverse your fatty liver or liver fibrosis. Next. So other thing is that too much of glucose or sugars will get converted into fat. So not too much of sugars, and small quantity of meals, routine exercises, good sleep, and don't wake up too much in the night. And late night eating habits do have a lot of injuries to the liver, because fat gets accumulated more when you have late night sleep and eat late. So many people I see working in IT or stressful jobs, they come back at 10 o'clock, 11 o'clock, have a pizza, burger, all these cheese-containing foods, and go to bed by 12 o'clock or 1 o'clock until they are playing with electromagnetic gadgets, then sleep at 1 o'clock, then wake up at 8 o'clock. So breaking the circadian rhythm of the cycle which the human being has been when they were created. So early to bed, early to rise, very important. Have food before 7 o'clock, go to bed at 10 o'clock. Don't eat heavily in the night, and also light diet and good sleep and good yoga, physical activity, exercise, predominantly vegetarian diet, occasionally meat, and to boiled meat, and no red meat and pork are very harmful for the liver. Next, please. So we have a lot of molecules which our Indian Society of Liver Disease do recommend for reversing the fatty liver and fibrosis. Some of the drugs I already told you, like vitamin E, saroglitazar, ursocholic acid, and pioglitazone, which control diabetes, cholesterol level in the blood, triglyceride level in the blood, also this fat in the liver. Next slide. So we already discussed what to do, tips for preventing fatty liver. So you know very well, and now you should be able to tell me everything that I've told you. And also you can spread this message to other people. What is a healthy diet? How should you follow the healthy diet? And what sort of exercise you should do? What should be avoiding and what should be taking? Next, please. So the message is, don't think that the previous slide, please. Don't think that only alcohol and virus can damage. So your liver could be still be at risk even you know you don't drink alcohol. That's the message. And the ayushmanliver.com will give you a lot of information about this fatty liver also. The most important thing, as I told you, is don't neglect your diagnosis of fatty liver and just keep sitting on it, a sitting duck, and getting caught in the liver cirrhosis and liver failure and ending up in transplantation. So you should be aware about this pandemic and widely spread problem, which is continuously increasing in numbers because of our sedentary life and overeating and unhealthy dietary food habits. So correct them, and I think we should be able to overcome this pandemic. Keep fit, keep slim, and also keep your blood test biochemistry in a good way that the liver doesn't get damaged by putting extra fat. Thank you very much. And I think the message, I didn't want to get the message very complicated. I made it very simple so that everyone can understand, even though there were some the medical technical terms and they did manage to explain to. I hope you should have been understood. If you don't have any, or if you have any problems of understanding this or you have any doubts, you can contact us. You can get our phone numbers from the chat box so that you can contact us if you cannot have your doubts cleared, or you can visit our center if you need more clarification and investigation. I thank the Zydus for providing this opportunity so that I can discuss and and share my thoughts on this pandemic problem, which is evolving all over the world and rapidly increasing in India. Keep fit and also love your liver, and the liver will love you also. Thank you very much.
Thank you, sir, for this wonderful talk. This has enlightened us very much. Now, sir, with your permission, I would like to hear your thoughts on few questions. So, the sir first question is that how common is MASLD and MASH in Indian perspective?
MASLD is very common. As I said, it's 1 in 3, and it can be 1 in 2 also. I think according to our statistics, it's 1 in 3. So every 3% you see one maybe having muscle, that means fatty liver. And then out of that, 30 to 40% progress to MASH. That means metabolic associated steatotic hepatitis. That's a injury to the liver happening in 30 to 40% of the people already had fatty liver or MASLD.
Yes. Sir, can MASLD MASH be age specific?
I didn't get it.
Sir, can we say MASLD MASH be age specific?
Age specific.
Yeah.
It predominantly happens in the teenage group, and plus from start from 20s, and more common in the middle age group. But nowadays, we are seeing in children also, like people who are less than 12 years old are having fatty liver. That means they are going to develop this cirrhosis by age of 30 or 40 years when the fatty liver progresses. And the children also starts having unhealthy food, more of this KFC, McDonald's, or McKinsey type of fast food categories. I think the numbers will be increasing very much. At present, we are seeing more predominantly in the IT group of population of people who are doing a more sedentary lifestyle, giving more work to the brain and not to the body, it's high. Between 25 to 35 years, this muscle is seen to be in a higher percentage.
Okay, sir. So, sir, is fatty liver reversible disease?
Fatty liver is definitely reversible. As I told you, by doing exercises, breaking the fat in the liver for utilization, taking an adequate, healthy vegetarian diet, and not taking unhealthy fast foods or processed foods or meat or trans fatty acids, and doing a regular physical activity, yoga, and maintaining your lifestyle quality. That means going to bed early and not eating too much and taking sleep at 10 o'clock after having food at 7 o'clock. So these things can prevent or reverse the fatty liver and including MASH also. Now we have newer drugs called resmetirom. Even if you started developing cirrhosis, these drugs seems to be reversing the fibrosis. It's new in the market. It will take some more time for it to appear in the Indian market. But we have a lot of other medicines like saroglitazar, vitamin E, pioglitazone, sodium acid. In high-risk people, we can use them to reverse the fibrosis and fatty liver.
All right, sir. So, on behalf of NASH 24 by 7, I extend my sincere thanks to Sir for his enlightening and engaging talk on MASLD. Sir's insight have highlighted the critical need for increasing awareness about fatty liver disease. I also want to express my appreciation to audience for their participation. Your feedback and suggestions are essential as we strive to enhance our future Facebook Live programs. So please stay connected with Nash 24 by 7 on Facebook for more updates and information about upcoming events. Remember, your health and health of your loved ones are paramount for us. Take care, stay well. Thank you once again for joining us. Thank you so much, sir.
Thank you very much. Thank you. You can share our appointment number, that is 9790583892. That's our appointment number. So if anybody have queries which have not been addressed or if you want to take some advice, you can call this number and we can give you advice as well. Thank you very much. Have a nice, happy weekend and good night. Bye bye.
Good night, sir. Thank you.